Hello and welcome. Today we're diving into a rare and complex congenital heart defect, Ebstein's anomaly. This condition affects the tricuspid valve, impacting blood flow and the overall function of the heart. Join us as we explore its causes, effects, diagnosis, and management. The exact cause of Ebstein's anomaly remains largely unknown, but it's generally considered a congenital defect, meaning it's present at birth. While genetics may play a role in some cases, with certain gene mutations potentially increasing the risk, most occurrences appear to be sporadic. There's a possible association with maternal lithium used during pregnancy, particularly in the first trimester. However, it's crucial to emphasize that this association doesn't confirm causation, and more research is needed. Ebstein's anomaly fundamentally alters the tricuspid valve, the valve located between the right atrium and right ventricle. Instead of properly separating these two chambers, the valve leaflets are displaced downward into the right ventricle. This displacement effectively makes the right atrium larger than normal and the right ventricle smaller. This malformation results in several critical problems. First, tricuspid regurgitation occurs. Blood leaks backward from the right ventricle into the right atrium. Second, the smaller right ventricle struggles to pump blood efficiently to the lungs. Third, the increased pressure in the right atrium can lead to right heart enlargement and potentially atrial arrhythmias. Finally, in severe cases, a hole in the heart, called an atrial septal defect or patent form in ovale, allows blood to bypass the right ventricle altogether, resulting in deoxygenated blood entering the systemic circulation. Ebstein's anomaly is considered a rare condition. Estimates suggest it occurs in approximately 1 in 10,000 to 20,000 live births. There is no known predilection for specific races or ethnicities. Because it is a congenital defect, it's diagnosed at birth or in early childhood in most cases, although milder forms may go undetected until adulthood. The signs and symptoms of Ebstein's anomaly vary greatly depending on the severity of the defect. Some individuals may experience mild symptoms, while others face significant challenges. Common symptoms include shortness of breath, especially during exertion, fatigue, a bluish tint to the skin, lips or nails known as cyanosis, indicating low oxygen levels in the blood, heart murmurs, abnormal sounds heard during a heartbeat, palpitations or irregular heartbeats, and swelling in the legs, ankles, or feet, a sign of heart failure. In severe cases, infants may present with profound cyanosis immediately after birth, requiring immediate medical intervention. Diagnosis of Ebstein's anomaly typically involves a combination of physical examination and various diagnostic tests. During a physical exam, a doctor may listen for a heart murmur. An electrocardiogram, or ECG, records the electrical activity of the heart and can reveal abnormalities. An echocardiogram, which uses sound waves to create an image of the heart, is the primary diagnostic tool. It visualizes the structure and function of the tricuspid valve and the heart chambers. A chest X-ray can show enlargement of the heart. In some instances, MRI or cardiac catheterization may be necessary to provide more detailed information about the heart structure and function. While there aren't formal classifications of Ebstein's anomaly, severity can be described based on anatomical and functional characteristics. These descriptions range from mild displacement of the tricuspid valve with minimal regurgitation to severe displacement with significant regurgitation and a small, poorly functioning right ventricle. The severity of the anomaly dictates the range of symptoms and treatment options. Treatment and management of Ebstein's anomaly are tailored to the individual's specific condition and the severity of their symptoms. Mild cases may only require regular monitoring. Medications can help manage symptoms like heart failure, arrhythmias, and fluid retention. These medications might include diuretics, antiarrhythmics, and medications to improve heart function. In more severe cases, surgery is often necessary to repair or replace the tricuspid valve. Surgical options include tricuspid valve repair, tricuspid valve replacement, and the cone procedure, which reshapes and repositions the patient's existing valve tissue. In neonates with severe cyanosis, a shunt may be placed to improve blood flow to the lungs. The Fontan procedure, which redirects blood flow directly from the systemic veins to the pulmonary artery, may be an option for individuals with a small right ventricle. Because Ebstein's anomaly is a congenital condition, there's no known way to directly prevent it. However, women planning a pregnancy should discuss their medical history and medications with their doctor. In particular, the use of lithium during pregnancy should be carefully considered due to its potential association with this and other congenital heart defects. Genetic counseling may be beneficial for families with a history of congenital heart defects. The prognosis for individuals with Ebstein's anomaly varies widely depending on the severity of the condition and the presence of other heart defects. Some individuals with mild forms can live relatively normal lives with minimal intervention. Others, particularly those with severe anomalies, may face significant challenges and require lifelong medical care. Recent advances in surgical techniques, such as the cone procedure, have improved outcomes for many patients. Ongoing research focuses on better understanding the genetic factors involved in Ebstein's anomaly and developing less invasive treatments. Regular follow-up with a cardiologist is crucial to monitor heart function and manage any complications.